Welcome to this special edition of Jamaica Magazine, the program that provides you with information on government's policies and initiatives. I'm your host, Enthros Campbell. The Novocorona Virus, or COVID-19, is now present in our island. The government has been taking a proactive approach to prevent the spread to communities. On today's program, we learn just what those plans are and much more about this novel strain of virus from an expert voice, Dr. Jacqueline Bisesa McKenzie, who is the Chief Medical Officer in the Ministry of Health and Wellness. Dr. Bisesa McKenzie, welcome to the program.
Thank you.
Good. We know you've been really busy, so we appreciate the fact that you could come to speak with us today. Tell us about the strategies that government is using to combat this spread.
Okay. Well, as most persons are aware, our main strategy focused around delay. And we're still at delaying the numbers from increasing. First of all, it was delay in getting the virus being in the country. Now it is delaying that increase in the numbers. And why delay? Delay in order to get us to prepare. Okay. Most countries do not have the kind of resources that just sit down and wait for these things to happen. So, most of our hospitals are full. And so in preparation of space, we have to make those necessary arrangements. So it's preparation on our part, but it's also preparation globally in terms of the development of vaccines and treatment that works. So stepping on from delay, of course, now is containment. So once the virus is in the country, what we are trying to do is to minimize spread of the virus and to contain it within that very small area that it is. Then, of course, we have to manage. All right, we have to manage the cases. We have to manage the public in terms of their awareness and how they themselves respond, separate from how the health system responds. And then, of course, we have to recover. And the important part about recovery is recovery in a better position than you were before. So those are our main objectives: delay, contain, manage, and then recover. But then in terms of our strategies that we use to ensure that these objectives are met, we have 5 main strategies. First of all, planning and coordination. And that starts even before there is any event that is happening in country. And this is about setting up a robust response mechanism within the health sector, and also how that is coordinated with a national response. And so we have our Emergency Operations Center that has been active, as you know, since dengue. So we were in operations, and then we have COVID. So now we are in 24-hour full activation, and our aim is to coordinate the response of the health sector, not just in terms of the public health sector, but also the private health sector, and also bringing in all the other stakeholders in health.
Right.
So our next strategy is in terms of surveillance and monitoring. And this again starts right from the beginning in terms of where was this virus expected to come from? It was expected to come from outside of our shores. And so therefore, the monitoring of our ports of entry was very key. And that enhanced surveillance we have going. I mean, many persons are aware of our activities in terms of yellow fever, malaria response. And in that, in protecting our borders, we have a public health team and a public health presence. But it is not just the public health, it's a coordination with all the persons that are responsible for protecting our borders. Key to this is our coordination with immigrations, because immigrations are the ones that are the first step. So in order to detect persons at our borders, we have to maintain this strengthened position and also to increase it around the country. In terms of the enhanced surveillance within the country as well, we know that we have informal sectors, and so therefore we have a very active community health worker program where we get information from persons within the community, and that of course has to be enhanced, especially as we have neighbors who have the virus present and will enter through our informal borders.
As we talk about the different our borders, people would say, well, we allowed people to come in. How would you respond to that?
I think, when you live in an island, it really is almost impossible to have security at every possible place that persons can possibly enter. And so therefore, our real surveillance officers have to be every citizen. Every citizen has to understand that there is a risk when you see strange persons within your community, because you don't know where they're coming from and you don't know what they're bringing with them. So they may bring infectious diseases, as well as, they may bring material that may be damaging to our plants and our animals. So apart from our formal ports of entries where we have persons present, every citizen has to become a part of that response. So just to continue in terms of our other strategies.
Yes.
So surveillance is to pick it up and to monitor what is happening. And then we have prevention and control. And many persons are seeing this, because this is about where it is that we do provide quarantine in terms of identifying persons that are at highest risk, in our opinion. So initially, the persons that were at highest risk of bringing in the infection to us were persons that were coming from countries that had transmission. Now, our strategy has changed where this is concerned, because of the persons at highest risk now of contaminating the population are persons who would have had contact with a confirmed case. So you see, we have shifted our quarantine now so that all the persons who would be household contacts, even though they are asymptomatic, would be placed in quarantine. And then we have isolation, so that whenever we have anybody that is a confirmed case, our aim is that we minimize contact and ensure that any contact is under full protection, so that there is no spread of the infection outside of that room. So prevention and control measures now have extended to public health measures, such as putting an entire community under quarantine and restricting movement in all parts of the countries in terms of people staying at home to minimize the risk. So these are all part of preventing and controlling.
Yes.
Then we have the health system response, which is what everybody wants to know. How is the health system responding? Well, certainly we have looked at the projections in terms of what it is that we expect to happen when this virus eventually had come to our shores. What are the expected numbers of persons that we expect to see, and how it is that we respond to them? And one of the first things here is really to get all the information and to get the accurate information and to circulate that. So we have developed several protocols and procedures, and we have circulate this to the wider community of healthcare workers so that they are prepared to respond. Then we have also ensured that in terms of the sensitization sessions that we do for the healthcare workers, firming up their infection prevention and control practices, getting them comfortable with working in situations where they have persons to manage. That has been a part of our strengthening and readiness in terms of the health system response. We also have to look at the critically ill persons, and that is where everybody knows that we have a problem in terms of staffing and also in terms of having critical care spaces. And so this is where delay is important to us, because of course in terms of the declaration of a pandemic means that resources now are allocated, because it's a global problem that is going to affect us. So the allocation of resources has now enabled us to make sure that we have the equipment for these high dependency spaces. So delay is important for us to allow those to come in, so that when we have critically ill persons, we're able to manage beyond the resources that we do have. And of course, communications. Communications is key, and I think as a ministry and as a government, we have tried to communicate quickly and efficiently with the public to make sure that they are informed. Now we know that there may be gaps, and we try to identify those as quickly as we can and to address them to make sure that the information is going out, persons are aware of what is happening, and that they know what to expect.
Right. So communication is definitely key. Going forward, is there a plan as to how we're going to be communicating as it relates to, say, press conferences or daily? What is the plan?
There is a plan now to regularize the press briefing so that the press will get the information on a regular basis so that the public can be informed.
Right. As we're trying now to keep the distance, right, the social distancing, are the press conferences going to be as they are now? People will meet in spaces?
Well, I don't have all the information
Yes.
on that, but we know that we are trying to keep within the directions that have been given. And thank God we're now in an age of technology,
Yes.
so we know that that can be utilized to provide the information.
Right. Doc, we've been talking a lot about COVID-19, but there are still some people who do not understand. Tell us, how is the virus transmitted?
Okay, so first of all, COVID-19 is the name of the disease, and it is caused by the virus, which is now called SARS coronavirus 2. A virus is different. A lot of people know about a bacteria,
yes.
right? So a bacteria is a bigger organism that can survive on its own. A virus cannot survive on its own. So it can only live for very, very short times outside of the body. It can only survive for very short times outside of the body. So you need person-to-person contact. That is the first thing in terms of a person-to-person transmission. And it is transmitted in the droplets when persons cough or sneeze, or even when some persons talk. Droplets, even in our normal talking, droplets are released from our mouths. But the droplets don't tend to go very far. Okay, they're fairly heavy, and so therefore they tend to drop within about 3 feet from where they started. Okay. Now there's no exact science, and you will hear some persons say 3 feet to 6 feet, and certainly I would say a minimum of 3 feet that persons would stay from one another. So it's usually when persons start to have symptoms that they will be able to spread this virus through these droplets. Now, we have a situation that some persons may be very mildly symptomatic, and there are 1 or 2 studies that are coming out now that are saying that persons, when they're very, very mildly symptomatic, that they can release the virus. So persons have to understand that infection prevention and control measures that they take does not only apply when somebody is coughing or sneezing. It is a general infection prevention and control measure that you should take in terms of staying away from crowds and to avoid persons that are ill. And of course, to wash your hands frequently, use hand sanitizers frequently, because the fact is that the person who was symptomatic may not be with you in the room at the same time, but they were in the room. So droplets may be there, and the droplets may survive for short periods on surfaces, and then you can get contaminated. Although that is not thought to be one of the main methods of transmission. The main method is usually from the symptomatic person who is coughing or sneezing, and the droplets move from one person to the next.
Yes. There is this theory about the time that the virus can last on different surfaces. Can you explain that to us?
Okay, as I said before, the virus does not have its own mechanism. It doesn't provide food for itself, so it depends on being in a cell in order to survive. So when you have a virus that is in a droplet that drops on a surface, its ability to stay alive is going to be dependent on how long it takes that droplet to dry out. So the type of surface may make it stay for longer than on other surfaces. The temperature and humidity in the room is going to contribute, because if it's very dry and high temperatures, it may dry out. The droplet will dry out and will not support the virus. For the most part, we would say that the virus may stay alive outside of the body for a few hours.
Okay, we're going to take a break now. When we pick up with some more information on the novel coronavirus, COVID-19. Stay with us.
What What to do if you think you have been exposed or are experiencing signs and symptoms of COVID-19. Immediately call 888-1-LOVE. That's 888-663-5683. In addition, you should stay at home. Don't go to work, school, or any public place. Do not use public transport, and avoid visitors to your home. You may need to do this for up to 14 days to reduce the spread of the infection. A message from the Ministry of Health and Wellness.
Welcome back to Jamaica Magazine. We're talking about the Novocorona Virus, COVID-19, with Dr. Jacqueline Bisesa McKenzie, who is Chief Medical Officer in the Ministry of Health and Wellness. Doc, tell us, who is most at risk?
Okay, the persons that are going to be most at risk are going to be the persons that have been in countries that have had community transmission. And certainly once those persons are in the country, persons in contact with them, and especially if we have a confirmed case. So those persons are going to be at risk. Now, this is in terms of the persons that are affected. This is a new virus, and the information that we get are coming from case studies, especially out of China. And these case studies are small case studies, and as time goes by, you will find a change in the information. So several case studies now have been saying that the elderly persons are at high risk for having more severe illness compared to the other age groups. But even now, new information is emerging that are saying that young persons and children may also be at a high risk of developing severe infection. And so at this time, especially when we don't know how this side of the world is going to be affected by this virus, I think that everybody should take precautions, because the virus will respond will act differently in different populations.
Right. Precautions. Tell us about some of the precautions that we can take as individuals to prevent getting this COVID-19.
Okay, so the precautions that person must take are really to the normal infection prevention and control measures that we have said. First of all, you are to avoid crowds, simply because you don't know who is sick. Persons may look well, but they may be sick. Somebody may cough outside the door. When they come in the room, they're not coughing, okay? So avoid crowds and avoid close contact with persons. Social distancing, persons are talking about that now, because in countries where they have gotten some control over the spread of the virus, social distancing has played a key role. And that is why we're saying that a minimum of 20 persons in a gathering, and even within that minimum persons gathering, you must keep your 3 feet to 6 feet distance. So that is one. Stay home if you are sick. Right now, everybody is concerned. Flu season is still on us, and so therefore we're seeing a large amount of persons who still have the flu. We have provided several hotlines. We have several persons manning these hotlines on a 24-hour basis. Call the Ministry of Health and Wellness hotline if you are sick or if you have concerns, so we can direct you what to do. In terms of your own practices, hygiene is important. The viruses you cannot see. You cannot see that it is on your hands. You cannot see that it is on a surface. So therefore, you should wash your hands frequently. Wash your hands frequently. If you don't have soap and water nearby, use hand sanitizer. But if the hand is visibly dirty, you must ensure that you use soap and water to wash the hands. Do not touch your faces. The virus will be transferred from hands to faces, and therefore nearer to the respiratory passages, where once it gets in, it will attach to those surfaces and then multiply to infect the other areas of your body. So you must desist, from touching your faces and spreading that contact. In terms of general measures, I would say for the population, I think persons need to do things to boost their immunity.
Yes.
A lot of persons are at home now, and so therefore they are out of a stressful environment, or some of them may go into a more stressful environment. So you try to keep your stress to a limit. Keep it down. Exercise, attention to diet. A well-balanced diet is what is important, that you're getting all the different food groups, including your fruits and vegetables. If we try to have good or portions of fruit and vegetables, that will add a lot of the vitamins and minerals, the antioxidants that we need to help us to fight these viruses and any other germs that are around. Very, very important is that persons must maintain good hydration.
Yes.
Okay, you must drink, make sure that you're drinking fluids so that your body is able to have good circulation to get all those nutrients to all the different areas of the body that it is needed.
Right. I know that some persons are having vitamin C, they're having D3, they're having all sort of things. Is there any is that problematic?
Well, I think the assurance of a good intake of vitamins and minerals at this time is important to fight infection and just to keep you generally healthy. As we talk about what persons are taking, I just want to ensure that persons who have chronic illnesses, that they are taking their medications, okay?
And by chronic illnesses, we mean,
for example, the common ones are the non-communicable diseases, the diabetes, hypertension, cardiovascular diseases. But you have also other disorders that affect the immune system. And so, persons who have, for example, HIV patients, or patients who have autoimmune disorders like lupus, rheumatoid arthritis. Everybody should be taking their medications to ensure that they're healthy and that their immune system is up.
Right. How long is the incubation period?
The incubation period, it lasts up to 14 days, but it may be as short as 1 to 2 days, with the most common period of 5 to 6 days that we're seeing.
Okay. So when someone gets this virus and you're over it, and your 14 days are passed and you're okay, does that mean you're immune to the virus?
Okay. The 14 days is really the time it takes for you to start developing symptoms. Okay. Once you start developing symptoms, it may take another 10 to 14 days for you to get over it fully. Okay, there are some viruses tend to last a few days to up to 14 days, and this is no different. So some persons will have a short course of illness, some people may have a longer course of illness. Now, once you have been confirmed that you have the disease, then we watch for when you become symptomatic. And usually about 2 days after you have become asymptomatic rather, we would do another test to see if the test is negative. And then 48 hours after that, we repeat another test. So 2 negative tests are what we need to say that you are fine. I just want to say that, having said that, though, we have to realize that sometimes you can pick up the virus for several days after, but the person may not necessarily be infectious, because sometimes you may have viral particles that are still in the urine or the stool, but the person is not infectious.
Right. A question that I've been hearing is, so I had chick-V and I had Zika, so that means I'm more likely to pick up this virus. Is there any truth in that?
Well, we have not seen any indication of that so far. This is still a new virus. It is still new, very, very new on this side of the world, where we've had large numbers of chikungunya and Zika infection. So it is only time is going to be able to relate the two for us to say, is it that we were seeing more cases in this population versus a population that did not have.
Yes. How likely is it for one to survive this? It's not, we're seeing lots of deaths. Is it just that people are going to die once they get it?
The case fatality rate is based on the number of confirmed cases that we are seeing. I don't think we're going to get a true handle on the denominator of that equation in terms of the amount of persons that are affected, who have gotten the virus, but who do not present to hospital or to health facilities. Because there are many persons are going to be sick and do not get any much more than a mild fever or a sore throat or a little runny nose or stuffiness. There are going to be a lot of persons like that with very mild illness who may not even seek medical attention. So, I mean, if we look at influenza, the case fatality rate of influenza is about 0.1%. And I think worldwide medical professionals are hoping that when we start looking at the bigger pictures in terms of what the real numbers are of persons that are affected, we're eventually going to come down to that kind of a case fatality rate. But I would say to persons, most persons are going to be asymptomatic. Most persons that are symptomatic are going to have very mild illness. And even a small percentage of those persons who are affected are going to have severe disease. And we are trying to put measures in place to ensure that we are prepared to manage those persons with severe illnesses so that we don't proceed to persons dying from this disease. But the reality of it is that some persons are going to become severely ill, and we may have deaths arising. But I would say to the general population, the majority of persons are going to get better and are going to go home and be able to tell their children and their grandchildren about it.
Yes, and the fact that some people have diabetes and hypertension and probably cancer survivors doesn't mean that they're going to die.
And this is why I say that they must take their medication and they must make sure that they're looking after themselves, because if you don't, you put yourself at a higher risk of getting a more severe form of the illness. And it's the same thing with influenza. We're in the influenza season. Persons must look after themselves and make sure that they have their immunity is at a good level so that they can respond to these illnesses.
And people shouldn't just stay home and drink lime juice or white rum or any. They need to see the doctor.
Not everybody needs to see the doctor.
Right.
And at this time, when we are trying to limit the spread of the infection, we prefer if persons stay home. We prefer if you call and we let you know what you are to do, because a person who is infected, taking a bus and then sitting down in a waiting area, it's likely to infect other persons, and we want to minimize that. Most illnesses are going to be mild and can be treated at home. Many persons can stay home and they're able to call in and tell us their concerns.
Yes. Quarantine facilities, how many do we have, and how well staffed are they, or prepared already are they?
Well, our quarantine facilities, right now we have shifted the quarantine in terms of putting persons in facilities. Right now it is the persons who are contacts with confirmed cases that we have in quarantine. The isolation facilities, now we are going to change how it is that we manage these patients as time goes by and the numbers that we are seeing. Because right now, everybody that you see that you have confirmed or suspect, you want to keep them away from the population. So you want to put them in a little space very separate from the population. But as we get more and more persons, we're going to find that we're unable to do that. And so we're going to, and we have gone into that phase now where we're converting wards. We have asked each hospital to prepare one ward so that we can isolate persons who are confirmed cases together on one ward. So right now, I would say to everybody in the population, anybody who has a cough or cold, evidence of a viral illness, they should stay home.
Thank you so very much for coming in to share with us on this very important matter, COVID-19.
Okay, thank you, and stay safe.
This has been Jamaica Magazine. Our guest was Dr. Jacqueline Bisesa McKenzie, Chief Medical Officer in the Ministry of Health and Wellness. While the new coronavirus, or COVID-19, is a virus that can cause death, in many cases, those affected can survive. Remember to always wash your hands, cover your mouth when you cough or sneeze, and always clean all high-touch surfaces. Stay away from crowded areas. Let's work together to conquer this health threat. Until next time, I'm Rose Campbell. Take good care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.